Yes guys, so today I'm just going to run through some common misconceptions about lower back pain and how I approach treatment with a lot of my clients. What I see with a lot of people that I speak to is they've already been getting hands-on treatment for the lower back pain. They're constantly going back to this person for that short-term pain relief. Now I think the misconception here with lower back pain is that when someone gets that lower back injury, it's generally really serious straight away and they think they're almost broken in a way. This creates that feedback loop for the hands-on treatment where they feel like they need to keep seeing this person every few weeks to reduce that pain because they might have had this injury for 2 to 3 months, maybe longer. They think they've tried everything, nothing has worked. And so this belief that they're broken in a way and they're never going to be able to get back to training like they once were, that's quite a logical belief to have if you think you've tried everything and nothing has worked. The way I would go about treatment for lower back pain is some really simple bits to start off with. So small bouts of frequent movement throughout the day. So if you're a desk worker, trying to get up and move every 20 to 30 minutes and simply just changing your position as well. So if you have the option to at work, not everyone does, but changing between sitting and standing, there's no such thing as bad posture. One posture isn't better than another one. But if you can alternate between the two, so for example, sitting, working for 20-30 minutes and then standing and working for 20-30 minutes and just changing the positions you're in, this is really going to help that lower back area. Another thing you can do, trying to improve your step count week by week, is a really good way just to maintain a base level of fitness, and it also will help blood flow to the area and reduce your pain a little bit as well. Now, what I'd also include with lower back rehab is nailing all the basics. Are you sleeping 7 to 9 hours a night? Are you eating right? How much stress are you under in your general life and at work? From there, so we've nailed movement frequency, step count early on, lifestyle basics in terms of nutrition, sleep, etc. Then I would actually go into some treatment options. I would start off with some things that are going to help move the pelvis. So some really good ones for this are anterior and posterior pelvic tilt. So you can either do this in sitting, where you're simply slouching as such from your hips, and you can pop your hands on your hips if you want to do that, and then sitting up nice and straight. So slouch and then nice and straight. So that's a really nice one. And you can do the same one on the wall. So if you stand up with your back against the wall, goal here is to try flatten that back on the wall. From here, once we've got that lower back moving, we can also run through a few core stability progressions. Core stability as a singular thing isn't going to get you back in the gym, but it can help short term with a bit of pain relief and just getting that area a little bit stronger. So a really nice way to start this is just lying on your back with your legs bent and on the floor, and then you're just going to push that lower back flat into the floor, hold for 5-10 seconds and then relax. The way you can progress this is simply just by lifting your legs off the floor. This will make it a little bit more challenging. From here you can progress to dead bugs, bird dogs. They're good for early stages of rehab, but they're not going to translate to your lifts like the deadlifts, squats, cleans, snatches, whatever it may be. From here, I would start to load different ranges of motion in the lower back. Load flexion, so bending forward. A lot of people think this is like some sort of dangerous movement. It's not at all. So a really good way to do this is the Jefferson curl. Now there's lots of variations of this. I would start off very light. Now you can either do this with a dumbbell, a kettlebell, a medicine ball. Standing up, you're just going to bend over from your back, curl back up. And then another thing you can start to do is some side flexion as well. So I would include things like side bends. Again, you can start off with these very light, like leave the ego at the door. Just start off with like literally 2 to 5 kilos. And then another thing you can do is start to load extension as well. You can start off with a Superman hold, and then you can progress just to doing some bodyweight back extensions on the floor. The way you progress that is on something like a GHD machine. You can load that with a dumbbell or a kettlebell holding in front here, or you can have a barbell on your back, which is a little bit more advanced, bit of a later stage progression to load those spinal erectors and get that extension movement going. Another thing that I would include with a lower back rehab is rotation of some sort. Now, although there's no rotation at the lower back, it seems to help people a lot with pain relief and accessing different movements again. A really good one for this is a half kneeling rotation with a medicine ball, throwing a ball against a wall. Then I would go on to some more mid to late stage stuff. Now, generally with lower back rehab, there isn't a specific set of exercises. So what I would usually do here is very simply just scale the lower and upper body exercises that people are typically doing or they want to get back to. So for example, let's say someone wants to get back to back squatting, I would go from the most basic regression that they can manage within that pain score. So if they can stay within a 3 to 4 out of 10, we could start off with a box goblet squat with the kettlebell out in front, just sitting onto a box at 90 degrees, standing back up. Once we can manage that, then we can progress on to a barbell box squat, for example, in back rack. Then if we want to improve depth, we can obviously decrease the height of the box. Within rehab, think about regressing something as much as possible instead of just jumping back to the same movement that you were doing before. It's all about those 3, 4, 5 regressions before the main movement, which will then help you reduce that pain slowly whilst improving the capacity of the lower back. But also psychologically, you know that the lower back's getting stronger, it's able to handle X amount of load per week, and you feel more confident moving weights and moving through different positions.